WIKB, Iron River, Crystal Falls, Amasa. Now, here's Dr. Larry.
Did you know? Let's go.
You've waited all week.
Every week, we continue to learn how to achieve a better back and ultimately better health.
Live in the WIKB studios, this is Dr. Larry.
Well, thank you for the flex to Pastor Lenny. Hello again, everybody. Okay, let's get it started. Well, as you know, every show builds on the next. Every week, we continue to learn how to achieve a better back and ultimately better health. Now, in case any of you missed it, last week we talked about orthotics. It was an important week to be tuned in because we learned and defined about custom orthotics for your feet because, let's face it, well, they are pretty neat. So here it is again. Orthotics. They are pretty neat for our feet, whether we walk, run, or hike in the woods, or stroll on paved sidewalk or street. Orthotics make us feel pretty complete. But which ones should you try and buy? Because the wrong ones can make our feet want to cry. So regardless if you have little feet, big feet, or your big foot, you'll want the best orthotics to keep you in line all the way up to your occiput, which is why you need to pay close attention to our previous guest from last week. She's the head of one of the most well-known multi-generational custom orthotic companies around, and her vision is to make sure you have premium orthotics when it's time for your feet to hit the ground, which was the main focus of our show last week and a piece of our review today. So for sake of simplicity, I called the segment Ask the President. Roll it. What are three primo case examples of foot levelers users that you are aware of recently?
Sure. Oh my gosh, I can give you a ton. The first one is someone, and this is actually one of the things that we're really passionate about at Foot Levelers, and we're so grateful that we can make such a big impact, is people who are experiencing chronic pain and who have relied on painkillers, even after multiple back surgeries. Now, this is an extreme case. Not everybody you're going to see has had a surgery. But for those people who have on chronic pain or they're on opioids, we want to get them off of those. And I have a story to thank Kella Andrews, who her testimonial is actually on our website. So I'm not breaking any HIPAA rules by sharing this because she wants everybody to hear her story. But her story highlights how proper foot foundation can truly aid healing. She was able to reduce her pain medication. She's happier. She was able to eventually get off of those. And additionally, she was able to actually be more mobile, because what happens when you're not in chronic pain? You don't have the inflammation and you can actually move. You can actually go through normal daily motions in life. And we hear that over and over again from people. So that's a really extreme example, but one that's really impactful because we want to get people off of those opioids. We know how addicting they are. We know how dangerous they are. And there's no reason to deal with any of that if you can simply put something as conservative as an orthotic in your shoe and get those types of results. And we have transformational experiences like that with people all the time. There's another person who, who was snowboarding in Colorado and had recently started using their orthotics and happened to think, I'm going to put them in my snowboard boots. And they didn't have to reduce their snowboarding to half a day because of sort of the residual, but comes with being in them for 3 or 4 hours. They had severe knee pain. They couldn't run, but it basically went away.
Wow.
And so we have, again, these extreme examples of people who are, in painful scenarios or dependent on additional drugs to manage pain, that have been able to completely move away from that and resume a very normal lifestyle. And then we've got people who happen to be like professional athletes and Olympians who wear our product, which I can't share names, obviously, for those folks, but we have plenty of those who we work very closely with who've said they've helped shave time, they've helped improve performance, they've helped improve recovery, because how important is recovery to performance? It's critical. If you're aligned in the way that you move, you're going to be more efficient. You're going to put less stress on those secondary and tertiary muscle groups, and potentially prevent injury, but also, increase the recovery time, which is critical to high school athletes all the way to pros. So there's a lot of different, examples that we have, and it's just wonderful that our product can be so impactful to so many different types of users.
Yeah, it's like you said, it's everything from like a stay-at-home mom up to an extreme athlete. But the proprietary process and started from the hammering out the idea in a garage to holding true to this day, but ultimately tweaking it because, and we didn't get quite into this, but there's a whole scope of products that you guys offer, because I think you guys can apply those to sandals, because people, of course, want to have open toes maybe during the summer months. You've got, I didn't even think about like the guy. So real quick, because
we make custom flip flops. I don't know of any other company that makes a custom flip flop in the world. Right.
So you got the custom flip flops, but you said, so the second case though, he was a snowboarder and shoved him inside like the boots and the snowboarding, like
Yep.
It's almost like a no-brainer. It's right there. Right. If you think, like, if you're skiing, right, why wouldn't you put an orthotic? Because those things are stiff and rigid and most likely not that comfortable. Smart move on that guy's part. Jamie, it's been awesome. I wanted to bring you on as the voice of the company to talk to the Upper Peninsula, to get the juices going, to now we know that you guys are going to do custom pillows coming up. And again, solving that riddle, which this is going to be fun on that one, because that's a real zinger for people, because even just like the kind of the typical, I'll say the chiropractic cervical pillows that we have out there in the market right now prior to this, some people can tolerate those, some people can't, but they're not custom. They're just basically mold to your neck and hopefully induce the curve into your neck. But I know people have struggled with those, so this will be interesting to see how this punches out into the market and how that takes off. If listeners want to get Foot Levelers products, how should they go about that? What is the most efficient, best way? Website, phone call? You let us know.
Oh, I love this question. Oh, I'll tell you. So we've got a Find Your Provider page on our website. So when you go to the homepage, you'll be able to see in the top right-hand corner, Find a Provider. You put in your zip code, and it will give you a list of providers in your area. So it's as simple as that. Or you could give us a call at 800-553-4860, and we can do our own zip code search for you. If you're not really into Googling something, we'd be happy to help you on the phone too.
Fantastic. Jamie, thanks again for coming on the show and highlighting all the best products and services and defining that custom term for us. Appreciate it.
My pleasure. Thanks so much for having me.
From toes to nose, Foot Levelers knows the body's ebbs and flows. A little sample and appetizer from some successful Foot Level users. And then when I finished up the show, I kind of took a little unique pivot there. And they have Foot Levelers custom pillows now, which actually officially last week has been launched. So they are taking orders. It does require you to be scanned by a professional who has their 3D scanning device. So that is a requirement. I currently don't. I believe locally, possibly Dr. Lindsay has it, and Northwoods Family Chiropractic, I believe, might have it. So if you want to get scanned for a custom pillow, which is brand new, there's nothing like that in the market right now. So again, one of those things, 130,000 data points, and then they just do a total custom pillow for her. In fact, I'm going to have Jamie on next month. I already talked to her about that, to talk about the pillows. And if you go on their website, footlevelers.com, you will see immediately, either on your smartphone or on your website or on your desktop, you'll see a little tab there that says Find a Practitioner. I'm listed on there as well, but like I said, I do the casting for the feet. Not the old school way. I'm not going to say old school. I'm going to say the tested and true way, or the non-technology way. It still works. But anyway, if you want to get 3D scanned, that's where you can find out locally. And then if you're outside of the local county area and you're listening from some other place, like we've had somebody listen from Florida, same thing, just kind of go on their website. Custom orthotics, they've got their number one best-selling one is In Motion. I know a lot of my patients that choose to do Foot Levelers like that one. And our orthotics Good for flat feet? Yes. There's ways to fit you with an orthotic for, you don't have to have an arch, so you can get fitted for an orthotic even if you have flat feet. Also, speaking of foot care, Queen City Running, now open in Iron Mountain. They have stores in Marquette, and they have a store in Houghton. Paige, one of the owners, is going to come back on the show. We're going to talk about shoes for everybody, even though it's Queen City Running. She says, honestly, Dr. Larry, a lot of our customers aren't runners. They're walkers and just average day people. If you hear this announcement on the show or you mention my show, you will get $20 off. That's all you have to say. I heard it on Dr. Larry. $20. They're already doing it. It's been improved. And so if you want to get fit for some new shoes, even before you get some orthotics, then you just say you heard it on the Dr. Larry radio show or Dr. Larry sent you, and they will give you an instant $20 off of your purchase. And their prices are equal to what you would buy online. The nice part about it is they've got some really neat policies as far as making sure that you are in the right shoe and how you're fit for the shoe. So this is where a brick and mortar place really helps. So Queen City Running and Foot Levelers, I got your feet covered and your spine. There was more. And if you missed the entire show and want to be more in the know, then log on to my website, drlarryradio.com. Hit the subscribe button, follow the links, listen to that show. It's been uploaded now, which you can listen to at your leisure as a podcast. And now beyond that, in addition to the happy feet, last week we learned a simple self-test for Achilles tendonitis. It was another Dr. Larry cool tool. And you can call my office for a freebie reminder just in case you're in need of a retip or a tip up. And so that was last week. Hi-ya. Now today we'll forget that monologue for a moment and keep remembering those mandatory communication skills all doctors must have, which are inquisitive listening and staying positive. Again, it often means the difference between sick and well. Also, it's another month of the year. Yeah. Let's keep our knees in gear. So in our tip and trick segment today, we're going to learn a simple self-test for knee health. And of course, you, Lenny Rocks, are calling it out right from the broadcast booth while we crank up the tunes and I hit the center stage for the demo. However, before all that, in order to have good health, you don't need a lot of wealth. So let's flex our forebrain and put some knowledge to the game, because today we're going to talk about, hit it, Pearl.
Dr. Larry brings you another segment of Did You Know?
Anesthesia. It's not amnesia, it's anesthesia. But it does knock you out for medical procedures which you know about. However, depending on your age, anesthesia might be fine or cause your brain to dim like the lights on center stage. Coming up, advice on anesthesia as we age, the awareness. When we get back from the break, stay tuned. You're listening to the Dr. Larry Radio Show.
Dr. Larry will be back in a moment.
What's cooking near you? Head to one of these fine local establishments for your next bite or beverage.
Buzz and Schmooze Mid-City Bar in Caspian opens 11 a.m. 7 days a week. Sandwiches, burgers, deep fried appetizers, shrimp and fish served 7 days a week. Call 265-9277 for carryout.
The Habit Bar and Grill, Highway A in Nelma, Wisconsin, and on the ATV Trail, offering premium gas. Opens 10 a.m. 7 days a week. Daily specials. Call 715-545-2646.
Kukali's Bar in Channing's open at 11 a.m. with happy hour 3 to 6, 7 days a week. Weekends, $5 loaded Bloody Marys and mimosas. Always serving Summer Place Pizza. Voted #1 bar in Channing. Check out Kukali's on Facebook for specials, live music, karaoke, and events.
The Alpha Michigan Brewing Company on the Circle in Alpha opens at 3 Tuesday, Wednesday, and Thursday, and noon on Friday, Saturday, and Sundays. Call 920-358-9551. Go to alphamibeer.com or find them on Facebook for tap menu and events.
The Horseshoe Bar downtown Amasa opens at noon 7 days a week. Burgers, sandwiches, nachos, crazy bread, specialty homemade pizzas, and deep fryer snacks too. It always tastes better at the Horseshoe Bar downtown Amasa.
The Local Eats List from WIKB WFER.
I would never recommend buying a home without having the water tested first. It's cool, it's clear, it looks clean. Oh, it tastes good. Well, what's really in it? And we just recommend that you check it out. I'm Jennifer Toivonen. I'm a co-lab director at Whitewater Associates of AMNESIA. Coliform bacteria, lead, arsenic, nitrates, nitrites. You want to be sure that water is safe. I would recommend giving us a call. That way we can tailor the kit that we send send to you for what you need. 906-822-7889. Give us a call.
This is Clovis from Iron River. You're listening to Dr. Larry's Radio.
At West End Home Furnishings, downtown Iron River, we have 2 showrooms full of furniture for every room in your home. Need carpet? We have that too. We're open Monday through Saturday and can be found online or by calling 265-1401.
An audiologist has extensive training preventing, diagnosing, and treating hearing and balance disorders. Research has shown people tend to underestimate the degree of their hearing loss. Rather than just selling hearing aids and fitting them, we try to look at the person and where he is as far as counseling and guidance on his hearing journey.
There's never been a better time to start hearing what you've been missing, and Lori LaFleur at Tri-County Communications will help you every step of the way on your journey to better hearing. Visit her office at 609 Central Avenue in Florence, Wisconsin. Give her a call at 715-528-4350 or find help online at TriCountyAudiology.com.
Break's over. Time to get cracking once again with Dr. Larry.
Welcome back. Surgery. Oftentimes, I'm advising patients, referring patients, discussing with patients surgery. Mostly in my line of work, it's typically the bone, joint, or nerve style surgery like total knee replacements, hips, rotator cuff repairs, back surgery, that kind of stuff. The bulk of the conversation is usually centered around questions from patients like this. How long should I wait? What is the recovery like? How soon until I can get back on my feet and normal life? Who's the surgeon you're referring me to, Dr. Larry? And so on and so on. Those are really the bulk of the questions that I get. So does that sound about right? Would you agree with that? Does that sound like, would that satisfy the equation as far as you making a decision whether you should have surgery or not? And I think, generally speaking, listening to people and answering questions, that's it. Now, let me bring up the anesthesia part. We know that anesthesia is part of surgery. It plays a big part, actually. In fact, you won't get your surgery unless the anesthesiologist clears you. I know situations where the surgeon was good to go, wanted to do the surgery, but the anesthesiologist refused and said, this isn't going to happen until you're cleared from what I say and these parameters. Even if the two disagreed, the anesthesiologist essentially trumps it. Now, of course, emergency situations can be different, but by and large, we're talking about this anesthesia when there's an elective surgery, let's say, or we can put a whole umbrella over it with the anesthesia itself. Now, as a side disclaimer, this is an awareness topic. It's not meant to be a deterrent. It's not meant to be anti-anesthesia. I've had anesthesiologists on my show. I've had a patient in my office that's an anesthesiologist. So it's not meant to steer you one direction or another. It's purely an awareness, and you'll find out why here in just a minute. Because it's the awareness of what? The anesthesia may cause temporary or permanent brain function decline, and the risk goes up as you age. Are you aware of that? In an emergency situation and or in a mandatory surgical situation, you have no choice. But the temporary or permanent effects are still in place. That does not go away. Meaning you may have a life-saving surgery, but you end up with short or long-term negative effects on your brain from the anesthetic. Take just a brief listen to this one article that I grabbed. The article is full of medical terms and pharmaceutical terms that there's no point in going over, but I want you to hear some of the main points I grabbed from this article. It's from actually the Journal of Anesthesiology. It's in March of 2019. Here's the title of it. Lasting Effects of General Anesthetics on the Brain in the Young and Elderly, quote, a mixed picture of neurotoxicity, neuroprotection, and cognitive impairment. So to say it Sprechen Sie English, basically there are effects, and they are toxic, and they cause impairment. That's what that title means. And here's a little bit from the abstract. General anesthetics are commonly used in major surgery to achieve the depths of anesthesia for surgery, patients are being subjected to a variety of general anesthetics alone or in combination. It has been long held an illusionary concept that the general anesthesia is entirely reversible and that the central nervous system, brain and spinal cord, is to be returned to its pristine state once the anesthetic agent is eliminated from the active site. However, as the article goes on to say, studies indicate that the normal functioning of these targets may result in long-lasting, undesirable effects. So the article focuses on the impact of general anesthetic exposure to the brain and summarizes the molecular and cellular mechanisms by which the general anesthetics may induce long-lasting, undesirable effects when exposed at the developing stage of the brain or at the elderly stage of the brain. So the vulnerability of aging brain to general anesthetics, specifically in the context of cognitive or thinking disorders and Alzheimer's, and I'm going to insert my own dementia into there. The disease pathogenesis is discussed, and I'm going to jump to the conclusion here for you. It's a mixed picture of these effects, so they can't quite drill it down. They know that there's these molecular changes in your brain and spinal cord. They know that there are some cases where there's short-term, long-term, permanent damage. And if it causes or induces things like Alzheimer's or other cognitive impairments or even dementia, I'll try to help clarify that for you in just a few minutes. That's what we're talking about here. And the reason why I'm bringing this up is because I know it's a question that's not asked, but I know it's a fact of surgery. It's in the waivers that you sign, which we're going to go over in our next segment here in just a few minutes. So the point is that the awareness side of it is just so you hear it. So when it comes time to make a decision, if yes or no you should have a surgery or not, you need to include this as part of the equation. Let's go back to the article for a second. In years to come, a large body of preclinical studies and accumulating clinical evidence has steadily strengthened the belief that anesthetics may produce morphological changes and long-term functional impairment in the observed incidence of POD ranges. Now, I'm going to explain what POD is in a second. This is kind of, again, we're smashing together real talk and real life with scientists, chemists, physicians. So I've got to split some hairs for you here a little bit, and I've got to drop into different categories to understand what we're talking about. But don't lose me yet, all right? So POD ranges from 10 to 45% that increases with age and surgical complexity. Some people are knocked out for 5 or 7 hours. I've had a patient that was just a twilight, gone for 5 to 7 hours. They were doing a surgery. Great surgeon, nicked a main artery, and they had to patch that thing up. So cardiovascular team had to come in, do their gig for about 4 hours. Well, now you've got what was going to be a 2 to 3 hour surgery on a middle-aged male has turned into a 7-hour surgery. So brain still has to stay dormant. So does the central nervous system. POCD was reported after the 26% of patients over 60 years. So the trend of the numbers is the fact that there is this lingering percentage of people as we get older that will have an effect, short or long term, from anesthesia. The slang way for me to say this, what happens to your brain, is your central nervous system gets washed out. You're not brainwashed, it gets washed out. And let me define what temporary brain function decline is first. Now we're going to go into those medical terms so you understand. Post-operative delirium. That was that POD that I just gave you. Post-operative delirium. This is the temporary condition of an acute confusion and disorientation that can occur after surgery, anesthesia, especially in older patients. Now, I'll tell you, sometimes, and take this the right way because this is directly from patient feedbacks, this is sometimes funny. People come out and say things they would never say. They'll come out and act in a certain way they want, and then when the dust settles, the doctor will say, hey, by the way, did you know you said this? And it's kind of a funny thing. So there's this post-operative delirium that happens. Now, when we hear delirious and we hear disorientation, but the reality is what happens with the patient is some of it can be a little funny. But the downside is what I'm focusing on. So again, what I hear and what I don't hear is the fact is this is not discussed often. And oftentimes, when it comes to the anesthesia effects, it's the funny side of things. Like, oh, I was knocked out. Best sleep I ever had. Really, none of it focuses on the actual components and the variables that happen with it. So that's why I'm doing it for a show today. Okay? So it's not a ha-ha funny show, but I've got to bring it all up so you hear it. Then there is the post-operative cognitive dysfunction, or POCD for short. It's like the military, in the medical, everything's shortened up with acronyms. This refers to a decline in the cognitive function that can last for weeks, for months, or even years after surgery and anesthesia, impacting memory, attention, and executive functions. What's executive functions? Numbers, discerning, balancing your checkbook, deciding what you want to get at the drive-thru at the fast food restaurant, that kind of stuff. Humor, writing out checks, getting on your phone, calling somebody, that's the executive functions of your brain. Those are affected. That's what that acronym means and why they labeled it, because they're studying it. So POCD. And then there's this delayed neurocognitive recovery, and they've got that as lowercase d, uppercase NCR. None of this you'll be quizzed on, but I want it to land on your brain while you're not getting washed out from anesthesia so you hear it when you're crystal clear. This term specifically refers to the foggy brain after surgery that experience may last for days to months. Most of us understand that there could be temporary effects, and I think many of you understand that anesthesia is a toxin. It's toxic for your brain. It's toxic for your central nervous system. And as long as you get the short-term temporary effects, then having the surgery you need is no biggie. However, I want to tighten this up a bit and draw your attention to the subject: elective surgeries as you age. For example, if you are 82 years old, your knee is bone on bone, you're overall mentally sharp as a tack, as I say, in reasonable shape, but your knee aches every day and it limits function but not incapacitates you, and you have a discussion with your team, your primary care doctor, your chiropractor, your physical therapist, your orthopedic surgeon, everybody says you are healthy, pre-op, cardiovascular, good to go, enough to get the surgery. Though it is elective, there's nothing life-threatening if you don't get it. So you have it. It's a success. The knee is fixed, but not you. Your family begins to notice over time you are mentally not firing on all cylinders, and it accelerates to within a short few years, you're mentally impaired. The question that I have for you was the elective surgery worth the permanent brain dysfunction versus the fact you could have lived with the knee aching? Which one would you rather have? No pain in the knee and function, but no brain function or less brain function. And you heard what I mean by less brain function. It's the executive level stuff. And executive level, hey, my wife's a stay-at-home mom. There's some executive level stuff going on there, okay? So we all have our executive level functions that we do in our daily activities. I want to paraphrase for you a few conversations I've had with patients over the years. Here's one. Dad got his knee done in his 80s, Dr. Larry, and his mind hasn't been the same since. Our whole family knows it. It was from the anesthesia. Mom got her hip done, and she's been mentally off since she's had it. She's okay, but something's not quite right. Doctors don't know because they've run tests. There's nothing they can really do about it. Now think about this. Do you have a family member that now you're hearing this, has this potentially happened to? Well, there's your answer, in case nobody framed it for you. Here's another question, though. Are you facing an elective surgery, and does it not have to be done? It doesn't always have to be a joint replacement, but if it's elective, yes, it could improve your overall quality of life in some way, but is it the risk of the brainwash from anesthesia worth it? If you have a question about this, log on to WIKB.com, click the Ask Dr. Larry forum, If you would like to send me a question regarding this topic, you can do that now. Again, it's wikb.com. Scroll down, click the Ask Dr. Larry, fill out the form. Maybe you're vacillating about a knee getting done or not. And, maybe you can live normal through your 70s, 80s, even 90s with a bone knee. I got a guy just in yesterday. I think he's maybe 90-something. He might need a new hip, but he's fine. So, again, I'm not deterring you from this. I'm bringing awareness. Maybe I can give you a few pieces of information that might help you. And guess what? WIKB has opened this avenue up for you. So you can do that right now, and I can answer for you. Everybody wants a freebie. I can give you a freebie right now if you do that. So to wrap this up, Alzheimer and dementia. Well, you pretty much won't be able to find a direct correlation in your research regarding anesthesia and Alzheimer's or dementia as far as it causing it. But let me draw back to one line from the article I mentioned. Anesthetics have also been shown to promote another hallmark pathology of Alzheimer's disease. What that indicates that is if you are predisposed to Alzheimer's or dementia, you have a family history of it, it may accelerate it. So that's what you need to grab and go from there. And here's just kind of a final article from newsmedical.net. Typically, older patients are more likely to experience POCD. Now, you know what that is. With around 40% over the age of 60, that ain't that old, who are hospitalized for surgery experiencing POCD on discharge, and 10% 3 months later, though patients of any age can experience this. So again, 60 now is what this article was pointing to. And there's some decent little facts in the article there. Some of them are repeat. So that's your anesthesia awareness. What I want to do for you is shift gears just a little bit and tie this in together on something I've done before, but it makes sense to do it now again. And that's your waivers. And I want to go over medical waivers, what you're signing, what they actually mean. I'm going to slow it down for you in the next segment. And I put a blurb from a medical waiver from a big box hospital that a patient signed when he was getting a surgery. And right at the top of the list that I put right here in my notes for you, it says, do not sign this form without reading and understanding its contents. Well, guess what? I'm going to do that for you when we get back from the break. Stay tuned. You're listening to the Dr. Larry Radio Show.
We'll be right back with Dr. Larry.
I got injured in a co-ed soccer league. They immediately told me that I'm going to have to speak with an orthopedic surgeon. My first thought was OSMS. I knew they worked with athletes in the past, and I knew that they had really good orthopedic surgeons. The team at OSMS really were all on board with getting me back to what my life was. My goals were their goals. I wanted to get back to my best, and they wanted the same thing for me. It's amazing that I can still do what I did before. I'm back thanks to OSMS.
Does your financial advisor take the time to really listen to you? Is your financial strategy personalized to you and your family? Will your financial advisor be there as your life and financial situations change? When you work with Ryan O'Grady, your Crystal Falls Edward Jones financial advisor, he focuses on what's important to you. You'll work together and use an established process to create a personalized financial strategy, backed by the advice, tools, and resources to help you reach your goals. And you can partner long-term to help your strategy stay on track. Contact Ryan today at 906-875-3833. Edward Jones, member SIPC.
When you're buying or selling with a RE/MAX North Country agent, we will use our years of experience to help you plan for now and later. So whether you need to upsize or downsize, move closer to your family, or further away, when you're ready to make a change, visit RE/MAX.com.
Here's your Iron River and surrounding area forecast. Sunshine mixed with clouds at times this afternoon, with daytime highs approaching 77. Southwesterly winds around 5 miles per hour. Partly cloudy skies again tonight, lows of a low around 60. Overcast skies tomorrow, chance for storms 79. From the Weatherology Weather Center, I'm meteorologist Jennifer Wojcicki on WIKB. Currently, it's 68 degrees.
This is Jackie from Vulcan, Michigan, and you're listening to Dr. Larry Radio.
An audiologist has extensive training preventing, diagnosing, and treating hearing and balance disorders. Research has shown people tend to underestimate the degree of their hearing loss. Rather than just selling hearing aids and fitting them, we try to look at the person and where he is as far as counseling and guidance on his hearing journey.
There's never been a better time to start hearing what you've been missing, and Lori LaFleur at Tri-County Communications will help you every step of the way on your journey to better hearing. Visit her office at 609 Central Avenue in Florence, Wisconsin. Give her a call at 715-528-4350 or find help online at TriCountyAudiology.com.
We're back with Dr. Larry.
Waivers. Let's define what a waiver is. I like the Sesame Street approach. It's a noun, and the definition is the act of intentionally relinquishing or abandoning a known right, claim, or privilege. It's a legal instrument that is evidence of such an act. I know you heard it, but what I know about us people is right now you could be in your car. Kid might have just puked in the back seat. Dog's barking. Got laundry going. Maybe you're like, I gotta get back to work, get lunch. I want you to hear this definition because this is what a waiver is. And if you add the medical waiver to it, it's the act of intentionally relinquishing or abandoning a known right, claim, or privilege. You're signing it away. You're abandoning your rights and privileges. So now that we know what a waiver is, let's listen to the next line of a medical waiver. I, patient name, put your name right there, voluntarily consent to Dr. fill in the blank. Okay, so this will all be filled in. What is voluntary consent? Voluntary consent is also known as informed consent and is freely and voluntarily given and mutually understood by all parties involved. And it is expressed through the affirmation and the voluntary words or actions that are mutual understandable of all parties. So what that means is you are abandoning your rights to the hospital and the doctor. You are affirming it based on your name and your doctor's name and where you sign, that you agree and affirm that you ain't got no waivers. I mean, you ain't got no rights. That's what the waiver says. And this is, by the way, this is literally the first couple of lines and paragraphs. Now, float over your head right now a couple of things. Anesthesia effects, short and long term. You abandoned your rights. You gave it up. So if you got brain fog for 5 days, 5 months, 5 years, or forever, it's gone. Infection, anything like that. And I'm going to get to that here in a second. In law, the consent is a legal term that means a person voluntarily and willfully agrees to another person's proposition. In this case, the proposition is doctor's going to do surgery on you, and they're going to have to put anesthesia in you, and they're going to have to cut and saw or redirect or replumb, all that kind of stuff, or scope, whatever. And the person who consents must have sufficient mental capacity, and consent also requires the absence of coercion, fraud, or error. So by and large, you're not going to be able to say that you're mentally deranged when you're signing your waiver. And also, they're really not coercing you. They're just saying, you sign it or not, but we're not going to do the surgery until you sign it because we have to have your rights. That's what you're doing. You're giving them your rights. Let's go over a couple more lines here. And as the result of this procedure being performed, there may be a risk of infection. There it is. Allergic reaction, loss of blood, removal or loss of function of any limb, including your brain, organs, paralysis, cardiac, respiratory arrest, or death. So you abandon all your rights to live. That's what you did. That's what the waiver says. I'm not reading between the lines here. I'm reading the lines. And let's go back to this short list with infection. I've had patients come in, knee replacement, but there's a guy right now floating around. Some of you may know him because he tells people what happened. He's had probably 10 surgeries on his hip. He's got infection there still, and he's just waiting for another one to come. Little grotesque, but a lady had a heart cath. She had a raging infection, and she had to sit. I mean, listen, this is an adult show, so I'm going to tell you. You don't want to listen? Dim it down right now. Chest wall cracked open, filleted open, separated with cellophane wrap for 6 months in the hospital because she had a raging infection from a cath, heart cath. She had to look down and see open intestines. She abandoned her rights. She signed the waiver. And this is not a deterrent. This is to help you understand what you're doing. Between the anesthesia wash, between what you're getting yourself tied into. And if you go back a little bit before the break, if you're having an elective surgery, is that knee really that bad at 84 years old? Is that hip bothering you that much? Is the rotator cuff that you have, that tear in there, I know it aches when you lay on it on your right side at night. I know it. I get it. But do you want to be put out for it and abandon your rights? That's all this information is here. That's what it's asking you to do if you want it or not. So that's what that means. You're voluntary consenting to this. Now, I've got a couple other little pieces of information here for you from just the waiver itself. I like to pull sometimes from some blogs because what you'll see in a waiver, it says that medicine is not an exact science. So there's no guarantees or admissions, and this is in the waiver, by the way, in large boldface caps or assurances to be made concerning the results or the success of the procedure, because medicine is a practice. So after your rights are abandoned, after all of that and the procedure's done, there is zero accountability on the success of whatever procedure is because it's all practice anyway. That's what the waiver says. So they tie that in there, and it's all true. Any physician will tell you it is the practice of medicine, yes. Correct. That's why it's in the waiver. Although you might have a talented surgeon, although they might have done thousands, sometimes tens of thousands of successful surgeries, it's still a practice. And you are signing the waiver acknowledging that you know that that's exactly what it is. It's just a practice. Bold-faced right there. When I got this from this patient who had a pretty big surgery, and I read this to him after the fact, it was kind of a bit of a deer in the headlights. He's like, it's quite amazing sometimes we actually sign away when it comes to this stuff. And so this is big legal document. This is huge when it comes to making life decisions on, let's say, elective surgeries. A couple more patient cases. I know a patient that has a colostomy bag because of the fact that when they did a surgery, it caused 20 pounds of his intestines to spill out in front, so they hung there. Extremely unsightly, very uncomfortable. Patient wanted to get it fixed for many reasons, of course, and the insurance denied it because they said it's cosmetic. So got an extra $50,000 to $75,000 floating around because that's what it would have cost to pile all the intestines back in, get rid of the colostomy bag, and look normal again. That's what that means. That's the consequences. In retrospect, I don't remember exactly if this case was elective surgery or not. My guess would be if this was an elective surgery, this person probably would have elected to not have that right given up because now he has a unsightly, for the rest of his life, thing going on with 20 pounds of his intestines hanging in front of him. So here's the deal. Whether it's the anesthesia effect, the brainwash, whatever it is, you can't associate medicine, healthcare waivers with like a deal you make to buy an automobile, let's say a new automobile, because there's warranties. You buy a new rig, you at least are covered bumper to bumper for at least 2 years, and you spend 60 grand on that thing, or the bank does, or both, and you go back and something rattles or shakes or whatever, or there's like a water pump went out on ours at 20,000 miles. They replaced it. It was included in the cost. There is nothing warranted, guaranteed, or included in the cost when you sign the document as far as medicine goes. And don't think that they've got your back. And this isn't really a negative swipe. This is just so you can hear it and how it's played out. So there's no accountability, but there's also no leverage as well, too, for the most part. I know and am aware of a case where there was complete negligence, medical negligence. The individual sued, got a settlement, and you would shake your head in disappointment overall. I know multiple cases like that. So keep this stuff in mind. Now, that's the whole point. And again, I got to wrap up this segment. We're going to get to the announcements and some other fun stuff coming up. And if you got a question for me, log on to WIKB.com. Click the Ask Dr. Larry. Fill out the form. If you have a question about this specific topic, maybe I can bring some clarity for you. That's the benefit of listening to the show. You're not doing something right now, and you're listening to the show. So ask me a question. WIKB has that set up. Glad people are using it. Had somebody bump in right now, a couple while we're talking. Okay. Upcoming announcements and our tip and trick of the week just around the corner when we get back from the break. This is the Dr. Larry Radio Show.
Dr. Larry will be back in a moment.
Flow aluminum dock systems are made to bring time at the lake to a whole new level. You can create any layout you want, accessorize it for comfort and fun. They are strong, stable, safe, and they add a beautiful touch to your shoreline that will last indefinitely. Maybe it's time to join the thousands of other families that have turned their dock into a shoreline paradise. Maybe it's time for a Flow from Jensen Akins of Conover or Three Lakes Docks and Lifts.
This is Julia from Iron River, and you're listening to Dr. Larry Radio.
Breaks over. Time to get cracking once again with Dr. Larry.
Okay, welcome back. A couple of things before we wrap up the show and get to the weekly tip and trick. First of all, remember at the top of the show, Queen City Running. Tell them Dr. Larry sent you. You'll get $20 off a brand new pair of shoes that they've got their 7-step shoe fitting criteria that they do. I've got some Queen City Running shoes myself. I've got to get my wife over there, and they ramp it up. They care about your feet. They really do, and they want to fit you with the right shoes. I sent a guy. He had terrible back problems, and he's probably listening right now, so you'll know who you are. But he's wearing cowboy boots. He wanted to get in shape, so he's wearing his cowboy boots to walk in every morning, like 3 or 4 miles. Look, I know cowboy boots. I'm sure they're comfortable. Okay. And I'm sure there's a bunch of ranchers out west and other people that love their cowboy boots. But if you're going to go walk on pavement or dirt road, there is a better tool you can put on your feet. So I sent him down to Queen City Run. They gave him $20 off. And he's like, these things are like walking on clouds, and my back feels better. I was like, bingo, good job. And he's got $20 to go out to lunch now. So, yeah, Queen City Running, any one of their 3 locations. Tell them you heard on the show and save you some. You get the shiny new hip and bionic knee. You talk with someone like me, a surgeon, nurses, and more. But how often do you ever get to hear directly from the manufacturers or distributors of these parts? You've got a Chevy or a Ford or a Lincoln in your garage. What kind of hip you got? What kind of knee you got? What's the brand name of that hip, baby? You don't know? I did some impromptu surveys. I go, people I know that had joint replacement. I go, what's the brand you got? What do you got? I don't know, actually. One person actually called and got the brochure. Well, I've got a representative from the Division of Orthopedic Implants from Johnson & Johnson coming in. Never before. Typically, you hear from all of us healthcare providers. This guy's got 30 years experience, Johnson & Johnson. He's in the OR every day, and he's the one that the surgeons lean on when it comes to, hey, what do we use, what size? They all talk together, and he's going to come on the air. I just texted him. He said, let's shoot for September, Dr. Larry. So nothing etched in stone yet. Amiodarone medication, heart medication with serious potential side effects. If it's prescribed, make sure that your doctor is following up with you and make sure that you are not having side effects. eventually at some point we'll have a show about that on a lady's husband who had that medication, took the medication, wasn't followed up with, and what happened to his lungs. Special thanks to, well, dual thanks, Lenny for stepping into the booth now and running all the commercials, doing the levels. He did a great job. He's going to do the tip and trick here. I like to say Saturday Night Rocks with Lenny because he's got that rocker voice and a DJ voice. So Lenny's going to be doing the tip and trick here. So thanks, Lenny, for sitting on the board. Keaton, my daughter, designed some of the layout stuff on my website and voiced one of the Edward Jones ads. Rito Dorito, he's still listening right now. He gave us a couple suggestions while we're live on the air. So thank you, Rito. Thanks for listening. And again, don't forget that link on WIKB.com and my own website, Dr. Larry, DRLARRY radio.com. There's 3 tabs to click, as you heard at the start of the show. There's a 4 listener tab that's got my shows listed on there. I'll have this one up. I've got the Snap one up, so if you missed that one on Snap Tenants, there it is. That's a freebie. There's also a subscriber app you can do, or a button you can push to that'll get you the log of all my other shows. And you can now find me on Spotify, Apple Podcasts, all those platforms. You got to type in my name in the show. So it's kind of new, so the algorithms won't pick it up quickly, but you'll scroll down, you'll see me, and if you want to start listening to some other shows, you can do there. So every option out there for you if you want to hear or listen to other shows, interviews, etc. As far as the another couple things I have coming up for the fall time, and I'm going to, like I said, Jamie, the president of Foot Leveler, is going to talk about the custom pillows. That one's got me intrigued because it's one of those questions where people ask me about pillows, and I go, you know what? I don't really know. I mean, I try to come up like a protocol for pillows. There's these soft pillows, hard pillows. There's fake foam pillows. There's, my pillow, okay? And people have tried that. There's bamboo pillows, the pillows that make your head cold. The pillows that, have a little dip in them so you're in the perfect posture. And I got to tell you, people just aren't that happy with their pillows yet. I like a down pillow, personal preference. I mean, if you want, I guess, just a knee-jerk, find a down pillow. I like the fact to recommend that 2 pillows seems to work, but Foot Levelers is going to have a custom pillow. So that's going to be kind of cool. And the next piece, what we're going to do with Paige and Foot Levelers, seems to be a lot of focus on feet, but feet comes up quite a bit. Feet comes up quite a bit in my office. Is we're going to talk about their 7-step process and their new location down in Iron Mountain too. And going back to my website, drlarryradio.com, there's also the syndication button, so there's some bio stuff on there. There's also the show clock, so if you're really kind of in a whole nother area and you want this show on your local area and you can't get it on some of the other places, then by all means check out that syndication tab as well. And I hope you got the theme of what I was going over. Like Jim and I were talking about in telephone time in between our non-commercials, is he made reference to something that he said, and somebody took offense to it, and a little shocking, to be honest with you, that this person took offense to what he said. It was so benign. Lenny actually heard it too. It might jog his memory. This was not a deterrent for you not to sign a waiver. It's not for you to ramp up a legal team and figure out a way around it. It's just slowing it down, reading the small print for you so that you understand and get the gist of everything, and also the anesthesia wash. I know for a fact this is something that doesn't come up, and like I mentioned, if it does, it's just kind of like a funny thing, like what happens to anesthesia, but there's this other side of it, and I wanted you to hear it. So it was an awareness show. Hopefully you got what you needed to get from it. And again, wrapping up the show here, we got about 2 or 3 minutes to go. I'm going to hit this tip and trick here in just a second. As far as that goes, WIKB.com, hit the Ask Dr. Larry, and I'll respond to your question. All right, Lenny, it's time for the weekly tip and trick. You head up to the broadcast booth. I'm heading out center stage for the demo, because today we're going to learn a simple self-test for knee health. Lenny.
All right, Dr. Larry, he's bending down there, grabbing his knee, checking his calf. He's shrugging his shoulders right about now.
Lenny, I mean, I started out the easiest play-by-play. I was checking out my hairy leg, thankfully still hairy,
Yeah.
You know what happens, Lenny? No one knows. As I'm getting older, you start losing the hair a little bit on the bottom of your leg there. You got it too?
I'm bald. The genes have worn the hair.
Is that what it is?
Yeah, I think so. I that's my guess.
It's got to be something like that, right? Or socks? Do you wear socks a lot?
I do.
Okay.
I do. I try to keep them down towards the ankle, but, you know.
Yeah, right. Do you ever check out your knee, make sure it's okay?
No.
All right. Well, guess what?
I go by feeling.
That's good. Inspect your knee for swelling, pain, tenderness, warmth, some bruising. Check to see how far you can move your leg in different directions. This is for all of us, including Lenny, including myself. Push or pull on your joint to evaluate the integrity of it. Just kind of see how it feels. I'm just going to pull that knee, hinge it a little bit.
Dr. Larry squeezing his knee there.
That's right. Tendonitis, if you push the little part of your kneecap there, or the inside, outside. I had a lady in the other day, I pushed the inside part of her knee. She tweaked it. Boo! She about jumped off the table. Little tendonitis on the inside part of the knee. Fluid. This is a good one. Another patient in yesterday, again, this is all based on y'all, is a lady came in and her whole leg was filled with fluid. The knee was filled with fluid, so it was more than just the knee. But again, you could see it clearly from the knee that there's something going on. So just going to follow up with her primary on that one. Stiffness. Hey, this is one too. The diameter, the circumference of your knee. Grab one knee and grab another knee and see if they're in the same ballpark. If one is bigger than the other, you got arthritis starting to build up and it starts to increase the diameter. This is a fun one. The back part of your knee, what you can do is kind of rub that a little bit, and you'll feel there's like maybe some little veins there. If you feel some pulsating veins or bubbly veins, whoop, varicose veins. Or if you feel like a hard bump, Baker's cysts. And then finally, note the temperature. Note the temperature. Is your knee hot? Is it cold? Is it normal? 98.6, you kind of know what that feels like. Does your knee feel good, or is it flared up a little bit? Sometimes you can catch an early infection by just feeling around your knee. So that's one of the simple things I do, Lenny, is helping people out with just the basics of healthcare when it comes to musculoskeletal stuff. And simple knee health wasn't even really an exam part of it. It was just basically observe, look, feel, touch, hold, caress your knee if you want to. Be nice to your knees. They're special to us. They're like hinges, doors. And folks, remember, you can listen to me live right here and every week to learn how to achieve a better back and better health. Or if you're having a pain or problem, I'm here to help. My number at the office is 906-875-3215. Have a good day, Lenny on the board, and I'll see you next week, everybody.
WIKB, Iron River, Crystal Falls, Iron Mountain, Kingsford.